So I'm Irene Mbwavi, a pediatric cardiologist, currently based at Karen Hospital.
One of only 15 pediatric cardiologists in the country, her interest in this specialty was fueled by her fascination with the heart, the engine of the human body. My name is Dr. Mercy Korir, and on this episode of Doctor's Diary, we bring you the story of Irene Mbwavi, whose desire is to see children and families free of the pain and agony that comes with a heart disease.
I really love working with children. I find them to be so easy to deal with because a sick child, you can always tell. Right? So now, when it comes to cardiology, I've always been so fascinated about the heart, and that desire to make a difference in these children is what drove me to specializing in pediatric cardiology.
Pediatric cardiology is a field of medicine where we are able to diagnose and manage children who come to us that have symptoms and signs of heart pathology. Pediatric basically means children. Though of course we see those who have not been born, we call them fetus. But we're also able to see even adults who are born with congenital heart problems.
Dr. Mbwavi's clients are children from those not yet born to those of any age with a heart disease. Adults born with heart disease but are diagnosed late can also be attended to.
Cases where a child has been born with. Then we have the acquired lesions where these conditions were gotten when a child was already grown. So congenital lesions are like holes in the heart that are known by the public. Or you could just have some issue, some complex issue within the heart. Yeah, and then now there's now the acquired conditions, like now the rheumatic fever, rheumatic heart disease, among many other conditions.
From Kakamega County, the mother of two, a 5- and a 10-year-old, says that her journey was not always easy, but her focus on the end goal, becoming a doctor who can make a difference in people's lives, never changed.
In our family, we do not have a medic. So every single time I would fall sick, or my relatives, my sisters and brothers would fall sick, we'd go to hospital, and I would always wonder how comes we don't have anyone in our family who can do this. I think slowly by slowly I came to feel the need, that desire to make a difference, both in our family but also in the general aspect.
The journey to medicine and pediatrics took Dr. Mbwavi from Kakamega to Eldoret to Nairobi and eventually to Chennai, India, where she trained for her current specialization.
I started my primary schooling from Township Primary in Kakamega. Then I did my class 8 at Lions Primary. High school was Moi Girls High School, Eldoret. And then my undergraduate was at University of Nairobi, postgraduate University of Nairobi. Then I did my fellowship program in India, Chennai, at Madras Medical Mission and at New York hospitals. My mom was a primary school teacher. She resigned. She's now around 65 years of age. She was a disciplinarian, yes. So yes, she really helped to inculcate that discipline in raising us. But also, my dad also was very strict on matters academia, because they had this very strong belief that the only way we could change our future was really through education.
A humble upbringing, strong-willed parents, and not wanting to be helpless in moments of despair are aspects of Dr. Mbwavi's life and personality that made her believe that she can contribute to making society a better place.
I came from a not so wealthy family because my dad was a secondary school teacher, because he's now deceased. My mom, who is now 65 years old, she was a primary school teacher, and the kind of difficulties that we have here. And I'm the second born in a family of 5 children. So by the time my dad, who was the sole breadwinner, died, At that point in time, I was still in high school. So my mom has really struggled to bring us up. So seeing the kind of struggles that she went through was for me one of the big motivating factors that, yes, I mean, that I needed to do better in terms of, I wanted to improve the life of my mom and also my siblings, but also I don't like seeing sick people. Like, I have always wanted to make a difference. Like, I remember seeing my dad in his suffering just before he died, and there I was, and I could not do anything about it. So that again was one of the reasons why I was like, no, I have to be a medic. Yeah, I want to make a difference. If only I can save a child's life or somebody's life, then that really gives me a lot of satisfaction. And that's why, Mercy, in my next life, I am not going to be anyone else. I think I will choose the same career.
Just like any other profession or specialization in medicine, Dr. Mbwavi's career has had its ups and downs, the good moments that remind her of why she chose this path, and the rough times that brings home the reality that she and others of her kind are needed by Kenya's children.
And this, honestly, is what keeps me going, because I saw a sick child, like before they saw me, they were unwell. And after I saw them, they became well. This is especially general, I'm talking now about general pediatrics. But now when I come to cardiology, again, same thing, that I saw this child who had a hole in the heart, and I was able to refer them to the right hands, either surgical management or the other management where sometimes we close holes without necessarily having to do the surgery. So in that case, I have definitely made a difference, because this child came with a hole, and the hole was closed. And the child now was able to go on with their, with their usual life. They're able to grow, and now the family is no longer stressed. So yes, that gives me a lot of satisfaction. We have this child who is 8 years old, came to us, and we diagnosed that the child, we diagnosed a large hole in the heart. And because of that hole, then the pressures in the heart were so high up. And whenever the pressures in the heart are so high up, then we are not likely to operate on this child. So it's very disheartening when you are not able, when you know your hands are tied, that you can only give medication, And that brings me to one of the areas that I'm really passionate about.
And it is these experiences, inadequate funding and investment in the public health sector, that pains these cardiologists' hearts.
I feel we do not have enough goodwill from the top. But of course, I stand to be corrected. So I wish they could be able to avail these funds to support our doctors to go for further training. Like I told you, it's actually not cheap training in pediatric cardiology fellowship program out there. So like personally, I went and trained myself, and I can tell you it was a pretty expensive affair. So I know there are people who desire to train, but they are not able to because of finances. So I'm just imagining if the government took this up and trained, say, like 20 pediatric cardiologists in a year. I mean, we would have a very good number, like in 5 years, and I believe we would all make a difference. My imagination would be that this has to be concurrent with, supplying necessary equipments in our public hospitals. A good example is like an echo machine, like in one of those county hospitals. There's no point in having an ECG and an echo machine in that county hospital without necessarily training a technician or a medic who is able to operate on them. So I think they have to go hand in hand.
When she came back to the country after training in India, Dr. Mbwavi worked in public sector before it was time to move on. Her shift from public to private sector was fully informed by a burning desire to grow professionally in cardiology. Looking back, Dr. Mbwavi does not regret making that bold move.
I had already given my best, to the public hospitals, but also I needed more experience, I needed more, I needed growth, which, to be honest, I felt I was not getting it while in Kenyatta.
Mm-hmm.
Yeah.
So what is it here then that makes the difference?
So the difference is that growth for me is happening here. In terms of whatever opportunity comes up at Karen Hospital, I am actually told about it, and I'm encouraged to learn more, because at the end of the day, when we are graduating, we are always given the power to read. What that basically means is, look, you don't know everything after graduation, but you're given that chance to further your studies. So here at Karen Hospital, I enjoy working here because one of the things that they do is encourage that. They motivate you, they actually push you to become better, a better person, a better cardiologist, like in my case, because they encourage me to go for CMEs. They basically push me to be better than what I was, right? And then, and also they take care of you generally in terms of pay, in terms of many other things. So that's why I have no regrets. It's not that hard. It's doable. We currently have 15 pediatric cardiologists, but my desire would have been that we need to really up the number. Yeah, 15 is we are so few for our kind of population. So my desire is in the next few years, we need to be more, so that we can have a larger impact in our country. It's always been my desire that eventually we get to manage everything right here. We have an issue with expertise. So we fall short on that bit, and I'm hoping our government of Kenya is listening and hopefully will help in terms of training more of us. Like I can tell you, personally, I had to sponsor myself to go out there for about 1.5 years in training in this fellowship program. And I can tell you it was not easy to leave my family behind, and I'm glad I had a very supportive partner at that point in time. And so, you have to pay for your own accommodation, you have to pay for your own studies, so it's like I used to pay both, I had expenses both outside there and here, and I can tell you, Mercy, it was not easy. Now that obviously is a bit discouraging for most of us, because one, you do not have, like, say, enough finances to take care of your family, because I mean the ideal situation would be going with your family for study and coming back. So that did not happen. So if only our government would see the need of training more of us, it would really be a great advantage, so that people don't have to go through what I did go through. And that, Mercy, for me is what is really motivating me to impact in my own small way. To make an impact in my own small way. Right now I have 3 mentees. Actually 4 mentees. One happens to be in Mombasa right now. So the 3, I keep encouraging them to come over, and just join me in whatever I'm doing. Basically just trying to encourage more of us to train. But also we as Karen Hospital are really trying to set up a fellowship program. If we manage to do so, then we will really be among the first in the country to train fellows in pediatric cardiology, so that we don't necessarily have people going out there to train. And that obviously will increase the numbers of cardiologists, because like right now the situation is actually dire. Most of us are concentrated in Nairobi. We have a few in Mombasa, then we have one in Eldoret. So how about the rest of the counties? No wonder we see children coming to us when they are extremely sick, and it really, I wish something could be done about it.
Dr. Mbwavi, the parent, encourages other parents to support their children in whichever path they choose to take. This is the philosophy that she lives by.
I'm a mom of 2 children, 10 and 5. There's one who has really expressed interest. The 5-year-old has expressed interest in doing what I do. But my firstborn is not interested at all. So my principle is, look, you will choose what you want to do. I'm not going to force you to do anything that you don't want to do, because at the end of the day, I want them to be happy. Yeah, I want them to live their lives. So whatever it is they choose to do, I will support them.
To rejuvenate and clear her mind from the day's schedule of keeping hearts beating, Dr. Mbwavi keeps her heart healthy by finding time to farm and teach her young ones the beauty of conserving the environment by planting trees. Baking and cooking, she says, are also part of her therapeutic regime. If not doing any of that, cycling in Karura, swimming or golfing are the next activities. Her spirit for the outdoors and adventures date way back to medical school when she and her colleagues conquered Mount Kenya. Professionally, Dr. Mbwavi's current focus is to go out on medical outreaches and identify children who need the intervention of a cardiologist early on before it is too late in life for them to have any meaningful living.
The heart by itself, just the fact that it's what makes us alive. Without it beating, then you're confirmed to be dead, right? So it was that. I just wanted to learn much more about it. And for me, I think the thing is at the end of the day was to be able to make a difference in that child. And by so doing, the only way of doing so is by learning much more about the heart, and then be able to advise the parents in case there's a problem, and that way basically just make a difference in the child's life, but also the family.
Dr. Mercy Korir for KTN News, Doctor's Diary.